Thinking about becoming a nurse in California? Here's how the path works. Nursing programs prepare students to care for patients in hospitals, clinics, schools, and community health settings. The journey begins with one key decision: ADN or BSN, an associate or bachelor's degree in nursing. An ADN is usually a 2 to 3 year program. Graduates take the NCLEX to become registered nurses and typically work in bedside care roles in places like skilled nursing facilities, doctor's offices, and some hospitals. A BSN is typically a 3 to 4 year program. Also requires passing the NCLEX and provides broader bedside care and training, more career options, and access to roles such as charge nurse, unit supervisor, or case managers, along with higher earning potential. In California, a BSN can be earned through traditional, accelerated, or hybrid online programs. Before applying, prerequisite science courses such as biology and chemistry may be required. Once accepted into a program, students train through classes, simulation labs, and clinical rotations. After completing the program and passing the NCLEX, graduates are ready to begin their nursing careers.